On the program this morning, we're looking at little teeth, big future, building healthy smiles from the start, and that's for our children. And why are we doing that? It's all because we want a situation whereby we can make things much better for our children and help them to live much better lives as they grow. Now, every parent loves to see their children smile, but that smile is more than just being adorable, especially for mothers. Caring for those little teeth early can shape your child's health for years to come, and the foundation of a healthy smile starts from the very, very first tooth, and of course a bright smile as well. We can tell you that a bright smile today can mean fewer dental problems tomorrow. So giving your children a lifetime of healthy, confident smiles is all that really, really matters. And that's why we're focusing on that, courtesy of RJOLAD Hospital this morning. And joining me in the studios, I have Dr. Oyapero Afolabi, who is a consultant dental public health with RJOLAD Hospital. Dr. Oyapero, nice to have you in the building. Good morning.
Good morning. Thank you for having me, and good morning, Lagosians.
Great. So we're talking dental care, right?
Yeah.
For our children. And those who are listening to us this morning will be wondering, why is it important? Why should that be a source of concern to us as parents?
Yeah, thank you very much. Now, I know most of the children, especially those in primary school and secondary schools, are at home now. And but when the schools are in session, do you know that more than 50 million school hours are lost every year because of dental diseases? And so because children have toothache, they have gum problems, they have one problem or the other, fractured teeth, and even something more serious than that, like fractured gums and even tumors. They take time away from school to actually visit the dental clinic. And that's why we are here to tell you that there are things you can do to preempt and to prevent these conditions.
All right. So it's very, very important. That's what you're saying?
Yeah, it is very, very important.
So at what point should we begin to care for the dental part of our children? I mean, for their teeth, at what point should we begin to be concerned?
Yeah, now there is a concept we call dental home, which a lot of people are not aware of, and they believe that, oh, when my child has a complaint, I'll go to the hospital. You've actually gotten that wrong. The dental home says that your child should visit the dental clinic or the dentist or dental care practitioners once the first tooth comes out or before their first birthday.
You mean it?
Yeah, that is actually the dental home.
There's always this kind of excitement by the time the child, comes out with his first tooth. And we are overly excited that all we just want to see is how he's going to do with that, right? Other than to come to the dentist. So you're saying that's the wrong way? That's the wrong approach?
That is actually a wrong approach. Now, you know that when you have a baby, right from the time that child is born, get into the house, there are certain visits you make to the hospital. They are preventive visits, including things for like immunization,
right,
and to do a lot of things that will make that child to grow up healthy and that will prevent diseases like tuberculosis, measles, and all those preventable diseases. In the same way, there are things that are done in the dental clinic. Some of them are called anticipatory guidance. In other words, there are things that the dentist can detect that will save you millions of naira in the future. So please make a dental home visit.
Right. So of what importance is this? I mean, can it help the development of the child? I mean, things like the mouth, speech therapy and all of that?
Yeah, now let me mention that I
need to get closer to that microphone.
Yeah, the mouth, the tooth, and the structures in the oral cavity, they are important for so many reasons. The commonest one we are aware of is for eating or mastication.
Okay.
But you also need them for a healthy smile. The other thing is that the teeth are actually space maintainers. The baby teeth, they keep the space for the permanent teeth. And then also the teeth are important for the jaw to grow. In some children where they actually don't have baby teeth, you find that the jaw is small. And so these are things that a dentist can pick at an early age if it is not happening at the sequence in which it's supposed to happen. And then the dentist will institute certain measures to actually prevent that problem from getting actually worse. And the other thing I want to mention is that what you see in the baby's mouth is a predictor of the things you see in adulthood. And so that's why why, for instance, some of us are aware that babies that are born premature, there are certain conditions that they can have when they grow up if they are not attended to while they're baby, including their weight and so many other things. And the same thing happens in the mouth. Okay. And so when the parent brings the child to the clinic, these things can be detected and they can actually be prevented.
So, Dr. Oyapero, at what point should we start? When do we start to, really be concerned, and then we can care for our babies, the teeth of our children?
Yeah, I already mentioned it. That is at when the first tooth comes out. If you can't do it then, you come at before their first birthday.
Okay.
Yeah.
So, how often should we do this?
Now, if you've not been to the dental clinic in the last 6 months, the child has not visited the dental clinic in the last 6 months, please, this is the time. And I know that many of us are, the children are at home now. Please bring them. Right there in RJOLAD, we have dental clinics all over Lagos State, in Isolo, in Bagada, also in Jara Mall in Ikeja. Please bring the children, let them have their skilling and polishing, let them have their examinations, and also let them have the anticipatory guidance, picking things that are little to you but can actually create big problems for that child in the future.
Right, so let's talk about some of those things that parents do. Some common mistakes that we parents make, that could damage the dental health of our children. What are some of them?
Yeah, right. Starting from cleaning of the mouth, I will ask mothers, what do you use to clean your baby's mouth? You hear things like glycerin, charcoal, ground glass, and all of that. Mm-hmm. Those are things that are actually dangerous. You are not supposed to use that. And that goes on to even diet. We have mothers that put sugary drinks on pacifiers just to make sure that the baby doesn't cry. Babies are given sweetened drinks on demand, prolonged bottle feeding, and this actually predisposes a child to what we call early childhood caries. Okay. The child starts developing decayed teeth at that early age. And others include the child watching the parents using the teeth for what is not meant to
like what?
You use it to hold things,
or use it to open soft drinks.
To open soft drinks and all of that. Those are things that can actually predispose the child to fractures,
yes,
and other conditions.
So let's get back to that issue of the snacks thing and the sugary kind of thing. But those sugar-coated biscuits and those drinks, they are made for the children. They're not made for us. So why are you saying we shouldn't give that to them?
Now, I will not say don't give children sugary snacks at all, or biscuits and all of that. That would be a very tall order. I will say reduce it to the barest minimum. And of course, also let them know that they need to have healthy snacks, fruits, vegetables. There are so many healthy snacks, chips, and all of that. If children are exposed to that at an early age, it will be helpful. And there are some other things that they need to do. You want to keep all those desserts and sugary snacks, you want to keep them to meal times. Okay. They should not take them in between meals, and they should not take them last thing at night, because that is when the decay occurs, when we are sleeping. So those bits of information, because the child just wakes up and the child is in pain, and the mother say, he just started complaining yesterday. No, it's a process that took over 1.5 years. That decayed process took over 1.5 years. And if these little things are paid attention to, but sometimes as a mother, you may not know all that. You need to bring them to the clinic where the healthcare practitioner will reinforce that to children. And children have very good memory. They will remember what they are told in the clinic. All
right, then. So let's talk about, the intervention from RJOLAD Hospital. So what are the things that you guys are doing?
Now, the first thing I need to mention is that RJOLAD, we have, it's a multi-specialty and a multi-specialist hospital. What I mean by that is that within dentistry, we have multiple specialties. Okay. We have the pediatric dentist that takes care of the children's teeth. We have the orthodontist, because one of the problems that is very, very common now is that children have poorly arranged teeth, what we call malocclusion. Their teeth are not looking beautiful, and this affects the self-esteem of the child. It makes the child withdrawn. They are prone to bullying. And we have an orthodontist in-house in the dental clinics in Jara Mall in Bagada that attend to all these conditions. And besides that, we have people that do root canals, endodontists, and all the other specialists, maxillofacial surgeons. And then when I say it's a multi-specialist hospital, there are some other specialties that are related related to dentistry, like the ear, nose, and throat surgeon, the eye doctors, the ophthalmologists. There are some times that you may need to consult them to actually give that child a holistic care, and all of them are actually domiciled within the RJOLAD hospital, and it will be a very good thing for you to pay a visit and access that care.
All right, so let's talk about the things that we should do. So how often should we bring our children to the hospital?
Now, we want it to be every 6 months, but if you cannot do that for any reason, at least once a year. But the ideal is every 6 months. And I'm emphasizing, we say, oh, the children are in school, they can't actually take time off school. Now they are at home. Mommy, daddies, please take time, bring these children to the hospital, let them have that scaling and polishing, have their teeth sparkling white, and let them also have a total dental checkup where we can pick things that you didn't even know are there, and then it can actually be prevented. All
right, so what are some bad habits that we should desist away from? I mean, you've talked about the issues of giving the children sugar drinks, biscuit. Any other bad habit, especially with the use of the teeth? Some of us use toothpicks and all of that.
Yeah, there are quite many, and those habits range from things that we do. Either we want to remove something from our teeth, like you mentioned, the toothpick. People actually use some other things like pins and all of that. That is actually wrong. Opening the soft drinks and other things with the teeth is actually wrong. Using the teeth to hold little things like nails, carpenters, a lot of people, they do that. That is actually very wrong. Then I mentioned the issue of snacking, eating sugary food. Besides that, I also talk about the mummies and daddies that are listening.
Okay.
At a particular age, you need to cut down on very hard diet. So you are in your 40s, you are in your 50s, you are still cracking chicken bone, meat bone, and all of that. As we age, the teeth get more brittle, and you find out that those teeth start chipping off, and it can actually be very painful.
Right.
And so those are all the other things that you need to pay attention to.
Okay, this is for the adults now. Let's talk about some other habits. Now, some people do not believe in brushing, with the toothbrush and all of that. They feel that making use of the chewing sticks and all of that might be better, and they try to introduce those children to it from early age. So what's your own thinking about this, doctor?
Now, for us, the chewing stick is not a no-no. In other words, you can actually use it sometimes, but we prefer that you brush with the toothbrush. And I'll tell you the reason why. The toothbrush is easier to use. It's particularly designed for ease of use, and then it can get to areas of the mouth that other oral hygiene products cannot get to. Now, for the chewing stick, you have to chew the bristles and make them to be of a particular consistency, and then you have to use them methodically, tooth by tooth, to clean them. That can actually require a lot of manual dexterity, which children don't have. And what I will say is that if you love your chewing stick, please use it in the night and use your toothbrush in the morning.
So how often should we brush in a day?
Twice a day is the ideal. That last thing at night, after the last meal at night,
right,
and then in the morning you should have your teeth cleaned.
All right, so Dr. Oyapero, I need you to tell me this, because a lot of times there's always this debate. What do you do first? I mean, I'm brushing at night, and I brush in the morning, I brush at night. In the mornings, how do we approach it? Should I brush first before I eat, or perhaps rinse the mouth, then go eat, and then come back to brush?
Now, it depends on the society and the culture you are in. The ideal teaching is that you should brush after breakfast, but in some cultures and societies, that is not actually acceptable to them, because you wake up in the morning and there's an offensive odor coming from the mouth, and the first thing you want to do is to rush to the bathroom and brush your mouth. And so whichever one suits you, please do it, but by all means, make sure you brush in the morning.
Okay, we're not skipping it at all.
Yeah.
All right, Lagos Traffic Radio 96.1 FM. We are talking about dental care for our children, from infancy to the time when they mature. And of course, you can also chip in something about your own health as well, your own dental health. I'm sure the doctor will be able to respond to it in the same manner. Get him here and talking about the traffic situation, Okwebi and the Salvation Road. I understand motorists have been advised to obey the traffic officers there. And that's because we have construction work which is ongoing within that particular location. So take note of that. Okwebi and the Salvation corridor, that's where you have that construction work ongoing. Also, there's a breakdown of a 12-tire truck loaded that fell. This is due to the bad portions of the road around Jakonde Gate inwards Isolo. So we have traffic managers on ground. But what we can tell you is that there's a backlog that has still towards NNPC. So that's the situation right now. Those of you within that particular corridor. Another breakdown is the one that is having a rare back tire problem at Oshodi inwards mile 2, just by Bolade. Yes, the owner, I understand, is working on it. And as a result of that, we're having moving traffic at the moment. All right, traffic managers on ground there trying to do the needful. Other locations heading towards the island is still looking good from Fadei connecting Funshaw Williams, Costain, and of course Eco Bridge linking up with Akpongpong is still a good ride at this time. We can also tell you, and those of you making use of the 3rd Mainland Bridge, it's also moving pretty well as at now. All right, then, so you might want to join the conversation as well, and that's on 08099120777 and 09153877127. Doctor, let's talk about the promo which is ongoing right now, courtesy of RJOLAD. What's that promo all about?
Yeah, thank you for bringing that to the attention of the public. In RJOLAD now, especially in the dental clinic, there is free consultation that is going on now. And somebody is saying, oh, I don't have any money. I'm not going to go to the dental clinic. It's going to be very expensive. Now we are saying, come in to all our dental clinics in Ikeja, in Bagada, in Isolo, and then you can actually see the dentist for free. And you can have a total checkup of all your oral tissues, your tongue, your teeth, your palate, and the floor of the mouth. And when that is done, then any condition that you have, you can actually have that detected and brought to your attention, and then appropriate care will follow.
All right, so who can qualify for this promo? Every
person qualifies for the promo.
Wow.
So just present yourself at the clinic, and mind you, at RJOLAD you are promptly attended to. There is no backlog, there is no long waiting time. Once you come in, you meet the friendly staff who will actually register you promptly, and then you will proceed to the dental clinic, a very friendly, healthy environment where you actually get appropriate care.
Can we come as a family?
Please, by all means, do.
Are you sure you guys will not be overwhelmed by this?
No, we are not overwhelmed. We're actually adequately prepared for that.
Right. Yeah. All right, then I still have with me in the studio Dr. Oyapero of Afolabi, who's a consultant dental public health specialist with RJOLAD Hospital, and he's bringing some good news to us as it relates to taking good care of our teeth. And they are saying, RJOLAD is saying, now that we're in the holiday season, let's make efforts to take those children for that routine checkup so that they can be properly attended to. All right, scaling and polishing is one vital aspect of care for our teeth, right?
Yeah, it is.
Do you do that for children as well?
Yeah, we do it for children, and children should actually have it done. We should actually take note that most tooth decay occurs in children below the ages of between the ages of 0 to 12. And so scaling and polishing is not just a cosmetic product to make your teeth more beautiful. It's actually a medical treatment whereby plaque, which is the load of bacteria on the teeth that causes most of the dental problems, is actually systematically removed from the surface of the tooth in between the teeth.
Let's take this call. Hello there, good morning.
Good morning, Mr. Victor.
Hey, Dr. Busari, how are you doing?
I'm fine. And to the doctor there.
Good morning.
Yes, his discussion is very interesting.
Right.
I'm in my 60s, but I'm used to first using chewing stick in the morning because I love the back, at the back of the chewing stick. I believe it will give me some kind of protection before I use my brush. Am I doing the wrong thing? And coming to your place, is it affordable?
Okay, good question. Thank you so much, Dr. Busari, for that one. He's in his 60s. He loves his chewing stick. He cannot do away from his chewing stick. So, is he doing the right thing?
Yeah, it is actually not doing anything wrong. The chewing stick, like I said, there are some that have actually been known to contain some medicinal products and even fluoride, and so we don't actually totally discourage the use of chewing stick. Like I mentioned earlier, that it is because it's actually more methodically difficult to use, and when also used inappropriately, it can actually abrade the teeth, make them wear away and all of that. So if you are doing it properly, don't throw away your chewing stick, but by all means, please also use your brush. So I think Dr. Busari is a model for us.
Okay.
He's using his chewing stick, he's using his brush. And so we can actually make him a model citizen.
Is there nothing we can do about extracting that particular chemical which people love in the chewing stick and turning it into a brushing ointment or something?
That is a beautiful observation. Actually, a lot of extracts have been made from some of these products, and I think that you have mentioned it now. I will think of how I can work with our chemists to do something interesting
in that regard.
Yeah,
that would be pretty good. Yeah. Lagos Traffic Radio 96.1 FM 08099120777. Now, Doctor, you guys deal with all of this, right?
Yeah.
We have sweeteners, and we have some toothpaste that appear to be laden with some of these sweets. I mean, they appear to be sweet, right?
Yeah.
So don't you think that would, on a long haul, harm the teeth?
Yeah, no, they don't actually harm the teeth. There are different types of sugars. We have non-milk extrinsic sugars, and these are they are not sucrose, they are not fructose, and all the other sugars that can actually cause tooth decay. They are actually artificial sugars, and the reason why they are there is to actually make brushing pleasant.
Okay, let's take this call. Hello there. Good morning.
Good morning, Victor.
Hey, this is Comrade, right?
Yeah, right, Victor.
Comrade Daniel, talk to me.
Thank you very much. Good morning, Doctor.
Good morning.
Yes, I think I just see this herbal toothpaste in the shelf of most of these grocery stores. Yeah, they actually extracted from these chewing sticks, and we don't know what it's made of. And secondly, in severe toothache, what is the best methodology? Is this by yanking off the teeth, or just go ahead treating it to reduce the pains? Those are my questions.
Okay, severe tooth pain. All right, toothache. All right, so doctor.
Yeah, thank you very much, Comrade Victor.
Comrade Daniel.
Comrade Daniel. Okay, so now for the chewing sticks, for the herbal toothpaste, what I will say is please look for the endorsement by the Nigerian Dental Association. Because there are so many products in the market, and some of them are harmless. Some of them are neutral, some of them are downright harmful. And that we are interested not only in how healthy and how useful these products are, we are interested in the quantity of the active ingredients. All drugs are poison. It depends on the dosage. So you want to make sure that the thing is there, it is the right amount, it is the right dosage, and it is the right product. So what I will say is that please look for the endorsement of the Nigerian Dental Association on any product you are using. Now, with regards to a very painful tooth that has likely involved the dental pulp, that tooth can be saved. In RJOLAD, for instance, we have endodontists that can actually do root canal treatment on a tooth, irrespective of the extent of the dental caries. But if the tooth is broken down, that means that it is not repairable, because there is an extent it will be break down to that you can actually still crown that tooth after the root canal treatment.
Okay.
But if it is not broken down, you can still crown it. But if it is broken down, sadly, you may have to extract that tooth. So the key is early presentation.
And the process of extraction is very painful, right?
No, it is not painful. It is not painful.
You don't want to scare anybody.
No, it is actually not painful. There is good pain control achieved on the dental chair.
All right, so we have some messages coming in here for you. 08099120777. Dr. Oyapero Afolabi is a consultant dental public health specialist, and he's taking us to the classroom this morning. This one says, good morning. Are sweet fruits like mangoes and bananas bad for children's teeth? Deborah Kemi is sending this one in. Thank you so much, Deborah. So, doctor?
They are not bad for the children's teeth. The sugar that you have in fruits, most fruits, whether you're talking about oranges, they are actually not as dangerous as sucrose. The real culprit is sucrose, but they can actually cause tooth decay if they are left on the tooth for a long time. So what is important is that once the children eat the fruit, please ensure that they rinse their mouth and swallow the water.
All right. This one says, good morning, Traffic Radio. Should I, it says, Okay, so should I floss my child's the teeth or wait till they are older? Mrs. Olabi, I don't understand that. Floss?
Yeah, I think it's clear to me that there is dental floss. Everybody should use dental floss. Now, dental floss is not for removing meat in between your teeth. Dental floss is an interdental brush. There is plaque that forms in between the tooth, and when you introduce that rope into that tight junction,
we'll get back to that. Let me take this call. Okay. Hello there, good morning.
Yeah, sorry, Mr. Victor, this is Dr. Musa again.
Okay.
I'd like to ask the doctor whether I'm doing the right thing. It's like I've just finished brushing my teeth now. But I learned that after brushing, that you don't use water to wash away, the remaining content or something in your mouth, that you allow it to stay. So that, because I use, after using the chewing stick, like I said, I use a toothpaste with zinc, then, and I rinse. But they said we should not rinse completely, that we should leave some of the content, So you understand what I'm trying to say?
Yes.
That you should not use water to rinse your mouth completely. You should still leave some of the toothpaste
in the mouth. Wow. Okay, let's allow him to respond to that.
Yeah, thank you very much, sir. Now, the ideal thing is that you should not rinse, especially children. I said ideal. If you must rinse only once. Look at it this way. You are using a mouthwash, and then you rinse your mouth with that mouthwash. You want the active ingredients in that mouthwash to work on your teeth. And then after using the mouthwash, you now take a jar of water and start rinsing. You rinse off all the active ingredients inside that product. And so we encourage that, especially for children, if you must rinse just once, just with a little amount of water, so that the active ingredients in that toothpaste can actually work on the teeth. But ideally you should not rinse, but most people cannot tolerate.
So can one swallow it? Can you swallow
don't swallow the toothpaste. Don't swallow either the mouthwash or the toothpaste. It's supposed to work topically on the tooth.
All right, so let's get back to the issue of the flossing now. So you said one can floss using dental floss is not meant to remove the meat from the mouth, right?
Not primarily meant.
So what do you use to remove meat?
It is still the same dental floss.
Okay.
But the primary use of that is an interdental cleaning aid. Because the same plaque that forms on the front and the back of the tooth also forms in between the teeth. Now, your brush cannot get in between the tooth. And so every day, everyone should run the dental floss in between all the teeth to remove the plaque in between. And that's why you find out that sometimes tooth decay starts in between the teeth.
So the sharp end of that floss, what should one do with it?
No, it's actually the rope that should be used.
Okay, it's the rope.
Yes.
What about the sharp end, the other end that has?
Well, if you must, you can use it to tease out the meat if you must use it.
Okay.
But you're not supposed to put it and push it in between the teeth to be pushing it out on the other side. Because that is actually going to widen the space in between your teeth and start creating some gum disease.
All right. So at what point should one begin to use it for children? Mr. Olabi is asking that question.
Once they have once they have teeth that are together, but for children, you should know that their gums are tender. You should do it very, very gently.
All right. Lagos Traffic Radio 96.1 FM 08099120777. Hello there.
Victor, Comrade Daniel.
Comrade Daniel is back. So it's the battle of the Daniels versus the Husaris. All right. So let's hear from you, Comrade Daniel.
As a child, growing up, when you brush, I know those days, my children are grown up now. I was, when I brush, the mom is brushing the teeth of the child, they can't swallow this toothpaste. And how do you prevent it? And what are the effects if the child keep on swallowing it when he brushes their teeth? That's my question, doctor.
Yeah, thank you very much. The first thing is that children, they tend to swallow, especially when you leave them alone to brush. So the first thing is that toothbrushing should be exclusively done by the parent or caregiver up till the age of 6. Between the ages of 6 and 8, there should be supervised toothbrushing. In other words, you can allow the child to brush in the morning while you do it for the child in the night, or vice versa. And then from the age of 8, if you have done the right thing, the child can brush on his own. So the first thing to do is to make sure that the children are using a child's toothpaste and not an adult toothpaste, because the concentration of the chemicals in both of them is different. The second is the quantity. You don't need a lot of toothpaste to brush. Just a granite or a peanut sized amount is enough. And so even if they inadvertently swallow it, it is harmless if the amount is very tiny. Even a rice sized amount is appropriate for babies, while for children just a granite sized amount. You can actually stain the teeth if the children swallow toothpaste over a long period of time.
Okay, then. More reactions coming in. This one says, good morning. Please, can children use mouthwash?
Yeah, thank you very much. There are actually very few mouthwashes that children can use. Please, I will advise the mom or the dad that is asking that question, please take the opportunity, bring your children for the checkup, and we can show you the ones that are appropriate for children. Most of the mouthwashes in the market are not child appropriate.
They're not child friendly.
Yeah, they're not child friendly.
All right, then more reactions coming in. 08099120777. This one says, good morning, Mr. Victor. Please, doctor, my 5-year-old's teeth are turning brown. Is it too late to fix them? 80 is sending this one in from Maryland. 80, thank you.
80, please head straight down to Isolo, Bagada or Ikeja and let us take a look, because there are some things that are simple and there are some that are more complicated to treat. So it is actually advisable that we actually, because thank God that at the age of 5, I'm sure that those teeth are likely baby teeth, but it can repeat in the adult teeth depending on what is causing it. So please, I would advise you to come over to our RJOLAD dental clinic. Let us detect what exactly. There is a gamut, there's a lot of things that can actually cause brownish teeth, ranging from the simple to the complicated.
All right, let's talk about some other things about teeth and, of course, dental health. Most of the diseases that we discuss on this program, some of them are, inherited, so to say. So can, dental issues be inherited as well, doctor?
Yeah, well, I will not say inherited directly like that, because we talk about familial and we talk about genetic. Interestingly, there are some genetic, there's some genes that have actually been associated with early childhood caries in very recent research, where it has been shown that just like people inherit certain genes that can predispose them to having breast cancer, the BRCA genes and all of that, there have actually been some genes that have been known to predispose to dental caries. But the other aspect of it is that we can inherit shapes of teeth that actually are more prone to tooth decay. We can actually inherit a kind of arch palate that can actually predispose to certain dental conditions and all of that. But the other thing is that some things runs in families. And what I mean by that is that not only the familial pattern, but also habits. What you see, the wrong things you see mommy doing, the wrong things you see daddy doing, you actually pick it up. And then that perpetuates the cycle of tooth problems. All
right, another question just coming in says, good morning. What's the safest toothpaste brand for little kids? Mrs. Bamidele is sending this one in. Is that something the doctor can talk about?
Mrs. Bamidele, I'm so sorry. I have not been paid to advertise. But I would just say, please look for endorsement by the Nigerian Dental Association. There we have a team in the Nigerian Dental Association dedicated to actually certifying every dental product safe for Nigerians. And so please look for that endorsement. Once you see that endorsement, it's a mark of quality. Please go ahead and buy that child toothpaste.
All right, then. So another reaction here says, good morning, Victor and the doctor. Is the use of braces a good practice in teeth arrangement? If not, what's the best way to go about it? Ola from Lekki is sending that one in. Thank you so much, Ola.
Yeah, the first thing I will mention is that, at the beginning of this program, we mentioned dental home and anticipatory guidance. Some children, by the time the teeth start coming out, you as a dentist will know that this child is going to need braces when it gets to an older age. And there are certain things you can do to guide the eruption of those teeth or the arrangement of those teeth, that the child will not actually eventually need full-blown braces. And so that's why it's important for you to bring the child to our RJOLAD clinic early. But once the teeth are fully out and they are overlapping, they are poorly arranged, you have those teeth jutting out and all of that, then there is no option. You must make braces for those children. Either that child is assertive or not, that child is undergoing bullying. Children can be mean to each other in the school. They would actually say very nasty things to that child. And that is why it is very, very important. And the optimal age is between the ages of 6 and 12. Where you actually need to come, and then when you need to set up the full braces, most of the time it is set up just before the age of 12 or around that time. So please bring that child. It can actually still be prevented, or the child may still need to wear the braces.
All right, so Ola is still reaching out to us. Says, what about in adults? talking about braces as well.
Yeah, there's adult orthodontics. Braces can be used at any age, and so if you are living with that poorly arranged tooth, you don't have to do that any longer at any age. It's just that it takes a little bit longer. If it takes about 1.5 years to 2 years in children, it may take up to 3 years in adults. But definitely, the arrangement of the teeth can be corrected at any age.
All right then, Lagos Traffic Radio 96.1 FM. Gradually winding to the end of the program this morning. I'm seeing some numbers here. It said, is it possible for one to overbrush one's teeth? Thanks, doctor is sending this one in. Okay. I don't know. Is it? Are you talking about doctor? Okay, so it's okay, Dr. Akinloye. Okay, it's Dr. Busari actually. Akinloye Busari. So is it possible for one to overbrush?
Yeah, it is, even though for most of the populace, they are not doing it enough. For us as dentists, we say toothbrushing sessions should take about 3 minutes. A lot of us in Nigeria here just do some movements and then you jump out of the bedroom and you are gone in 30 seconds. So ideally, toothbrushing should take place over a period of 3 minutes. But there are some people that do it over aggressively and they actually use a hard toothbrush which is not meant for the mouth, which is to be for the
all right. Let's take this last call before we wrap up things. Hello there, good morning.
Yes, hello Mr. Victor, good morning.
Good morning.
Yes, my name is Femi. I'm calling from Magodo.
Nice to hear from you, Femi. Go ahead.
Yes. So I just want to clarify something. I'm just trying to be my brother's keeper.
Okay.
So I just want, and I'm sure the dentist, the doctor there is also aware. There is no toothpaste. There is honestly no toothpaste in our current clients that can whiten a teeth, especially if they are getting older, because white will eventually fade off. There is no white that stays white totally.
Okay.
White eventually fades. The toothpaste companies just market this thing like teeth whitening and all that. There is no toothpaste in this, especially in this current Nigeria, that will whiten any teeth. The only way to whiten a teeth is by going for aesthetic cosmetic cleaning.
Right.
So I don't know why they always market toothpaste and try and deceive us that use the toothpaste morning and night your teeth to get white. There is no toothpaste.
Okay.
And that's my own.
All right. Thank you so much for adding your voice to the conversation. So, is Femi correct, Doctor?
Yeah. There is actually some element of accuracy in what is said.
Okay.
And because there are actually different types of stains. There are stains that are on the tooth, which we call extrinsic stains, and there are some stains that are inside the tooth, which is intrinsic stain. So, if it's an extrinsic stain, to an extent, the toothpaste can help, because the toothpaste contains some abrasives that can actually remove all the stains on top of the tooth. But if it is inside the tooth, then the patient will need one form of aesthetic treatment, like Mr. Femi mentioned,
right,
or the other. And so that the toothpaste is not going to solve that problem. You have to present in the clinic.
So is whitening, is teeth whitening, is it desirable? I mean, this is something that one should advise?
Yeah, if it is properly done in the right hands, because there are actually some people that are actually doing it now in spas and some other places, and they don't have the knowledge about the structure of the tooth and certain things. Like I mentioned the other time, that some things are not child appropriate. And a mother can bring a child to the dental clinic and say, I want to whiten my child's teeth. I will say, no, at this particular age, we can't do this, we can't do that. So if it is done by the right person, yes, whitening can actually make the smiles bright, and we actually do whitening in our RJOLAD dental clinic.
All right, let's get to round this all up right now. Doctor, I put cold water in my mouth, I feel some sensation, or I put a hot thing in my mouth, I feel the sensation. What's that telling me?
That's telling you that you have dentinal sensitivity. Now, the first layer of the tooth is the enamel, the second layer is the dentine, and the third layer is the pulp. The dentine is not supposed to be exposed. It can be exposed due to tooth decay, a cracked tooth, over aggressive brushing. And so when you start having that shocking sensation, it's telling you that the tooth is on a bad journey. And you need to present early. Presenting early in the clinic to have it. The dentin can be sealed, fillings can be done, and then the process can be arrested.
Okay then, so we'll leave it at that for now, so we have to go. So what's the message quickly as we round off?
As we round off, I will encourage Lagosians. There is a promo going on in our RJOLAD Dental Clinic, totally free consultation. Please take advantage of these. Bring the whole family and take advantage of that free consultation. Get a free checkup, and then let the conditions that you have be addressed. That can be at Bagada, RJOLAD has many branches, but for the dental now, there is a branch in Bagada, in Ikeja, in Jara Mall, and also in Isolo at Cooper Hospital.
We'll leave it at that for now. It's nice having you in the building. Thank you so much for being here.
Thank you so much, Mr. Victor.
Dr. Oyapero Afolabi, consultant dental public health specialist with RJOLAD Hospital. And this morning, he's been able to give us all that we need to know as relates to care, dental care for our children and even for ourselves too. So let's do the needful by ensuring that we take advantage of the promo which RJOLAD is offering during this holiday. Mike James has produced the program this morning. Maximum shout out going out to Okpeyemi Shodunke, and also a big shout out going out to Remy Aluko. Let me appreciate our executive producer Tayo Akonle. My name is Victor Oteri. I'll be back shortly for the benchmark.